before I get to that, obviously the breaking news is the fact that Beau Biden, at the age of 46, has died from brain cancer. And this was a breaking news that we covered this morning on Fox News. Joe Biden just mentioned that, unfortunately, this weekend he passed away from aggressive brain cancer. He's been struggling with this since 2013. In 2010, Beau suffered from a minor stroke, which I'm not sure if it's related to this or not. But in the last 2 years, he's been struggling with this, had surgery for a small lesion, supposedly, at MD Anderson, and was declared free of cancer until this spring, where the cancer came back. And unfortunately, we know that these brain cancers are very aggressive and the prognosis is quite poor. He was Attorney General for Delaware for 2 terms, and he was set to run as a governor of Delaware, and unfortunately his life was shortened as a result of this cancer. And I wanted to bring up an expert in the field. Dr. Langer from Neurosurgery at Lenox Hill Hospital is online, and I know that there's about 70,000 of these cases in a year in U.S. that's being diagnosed. 14,000 people die from brain cancer, and there are so many different types. So I want to bring Dr. Langer on the phone, and maybe you can make comment. David, good morning.
Morning, Dr. Samadi.
As you heard the news about Beau Biden, and at a very young age of 46, who died from brain cancer. We're not sure exactly what type of cancer this is and what kind of glioma or glioblastoma, but I assume that it's obviously a very aggressive type. What is your take on this? What do people need to know, and what's the update on this case?
Well, first of all, whenever these things come up at all, whenever a public figure, young, healthy, seemingly, guy with all his future ahead of him, when these things happen to people like this, it's always a shock and causes us to ask questions like this, and our hearts go out to the family. And in general, these are unfortunately types of tumors that take people in the prime of their lives. They often happen in young, otherwise healthy people. They're not particularly common, but still, 20,000 or so Americans will die every year from tumors like this. And so it's not so much the number, but the types of people that succumb to these tumors. They're often otherwise healthy. They're not necessarily smokers, or these types of cancers don't have the same associated factors that many others, like a breast cancer or a lung cancer, might. And so given that fact, it causes a lot more consternation amongst people, like this could happen to me, and that's why we're having this discussion.